So these are going to be hip mobilization techniques used for knee pain, knee osteoarthritis, patellofemoral pain. Some clinical prediction rules where these would be effective would be decreased passive hip flexion and internal rotation, anterior thigh pain, tingling or paresthesias in the groin area, and then pain with distraction. So some mobilizations that we're going to do are going to be the caudal glide of the hip, the anterior posterior glide, and then the army crawl mobilization. And we can do mobilizations in grades 1 and 2, which will help with pain, and then 3 and 4 will help with decreased range of motion. So we can increase range of motion with grades 3 and 4. So first one I'm going to do is going to be the caudal glide with belt assisted. So the patient, I will put this belt around my waist, just around my hips, and then as well around the patient's thigh. Okay, like so. And so then we're going to move the patient's hip up into hip flexion, and then make sure the belt isn't on the patient's thigh to cause pain. And so what we're going to do is I'm going to be providing a caudal glide with the belt, and then a cephalo glide anterior with my hands right underneath the knee. So I'm going to have him like this, and then you can either have him also in hip internal or external rotation. And so I'm going to provide a caudal glide with the belt and a cephalo glide with my hands, like so. And you can perform this in any of the grades. So that is going to be the caudal glide. And then the anterior posterior glide we'll have the patient here, and I'm just going to switch legs for video purposes, but I'm going to have this leg, and you cross it over the other one like so, and then I'm going to apply a anterior to posterior force on the knee. You don't want to go right over the kneecap. You want it to be more comfortable for the patient, so just go around the knee joint like so, and provide the anterior posterior mobilization like that. And then the third one is going to be the army crawl. So they're going to be on their stomach in the prone position. And then this knee, we're going to put them in the figure 4 position. And then we're going to have a towel underneath this knee for comfort, like so. And then I'm going to get as close to the joint line as possible. And I'm going to be providing a posterior anterior force at the hip joint, like so. And so these mobilizations can be done with hip pain or knee pain and patellofemoral pain, knee OA, hopefully to decrease pain with functional activities and increase range of motion.